Cayuga County is not alone in seeing more COVID cases, most in unvaccinated.
And we know a lot of kids can't get the shots yet. With the virus surging, at least 6 new COVID cases have been detected in children under the age of 10 in just the past couple of days. Cayuga County Health Director Kathleen Cuddy joining us now live. Kathleen, thanks so much for being here.
Thank you for having me back.
Kathleen, start out, because we haven't talked to you in a few weeks now. Give us an update. Where's Cayuga County stand right now with the latest surge of COVID-19, new cases, vaccination rates? How are you doing out there?
So Cayuga County is mimicking the rest of our nation largely. We are seeing an uptick in cases. Our understanding is it's also the Delta variant that is happening. It's very highly contagious. We have our highest numbers we've had in months right now. Today, we have 37 active cases in isolation. When I say cases, that's people, and even more people than in quarantine related to these people who are newly positive.
All right, 37 cases. That's troubling. The news about the kids under 10 who've contracted the virus, 6 in just a couple of days, may not sound like a lot, but how concerned are you with this?
It's very concerning. Children cannot be vaccinated, as you stated. They're being brought into social situations. They're not staying home when they're symptomatic. A lot of the symptoms that these children have do mimic other illnesses. It's really important when your child is ill to be diagnosed, rule out COVID before you bring them somewhere. We've had situations where children had sniffles and a headache. They went into social situations with people outside of their household, and it has spread from there.
How are those kids doing, generally speaking?
Overall, they're doing all right. It's relatively mild symptoms based on the knowledge we had at the time of the interviews. Fever, cough, fatigue, congestion. That tends to be the norm for these children.
Are you expecting more kids, unfortunately, like this?
I think that we will see that, unfortunately. You know, we've had situations in daycare centers where there have been daycare providers and daycare children who've been positive. We've had sports team interactions. We've had social situations. You know, this is alarming to us because we know school is coming up. So if we can't get this in check now, these children who cannot be vaccinated could easily go to school. And we don't want to see children quarantined from being in the classroom. We want to bring our children back into the classroom for learning.
All right, Kathleen, spell it out for all the parents listening. What can they do to prevent this, to stop this spread?
Parents need to be vaccinated themselves. All adults who are eligible for vaccination should receive it. We only have about half of our Cayuga County residents vaccinated at this time. And we know that there are unvaccinated people who are not adhering to wearing face covering. We know that because when we look around in a grocery store, for example, half the population isn't necessarily wearing a face cover. That's just an example. And children cannot be vaccinated. We need to protect our children. For those children who can get the vaccine, give it to them. Give it to them now so they are prepared to go into the classroom with their vaccine taking action in their body to help them.
My guess is that there's no issue with supply. There's clearly a lot of people out there, as you just mentioned, in your community not vaccinated. Convince them now's the time to get the shots. Here's your forum, open opportunity to convince them.
Thank you. Now is the time to get the shot. As soon as you were eligible was the time to get the shot. But especially now, if we want to keep our children in school, we need to get the shots now because there are often a few weeks between your first shot and your second, and then 2 weeks after that until you're fully immunized. Additionally, to the schools, we want to protect our kids in our daycares. We want, as working parents, to be able to continue to be at work. No one wants to be in quarantine. No one wants to be ill. So get our vaccine if we're eligible, wear our face covers if we're not eligible, and still give great consideration to how you socialize with people outside of your household. Wear your face covers, try to interact with people who are also vaccinated. That lessens your likelihood of being exposed to the virus.
All right, we appreciate you being here tonight, and hopefully people are listening. Thank you, Kathleen Cuddy.
Thank you.